So welcome back friends, welcome back in another video tutorial from microbiology with Charnik. So in that video tutorial we are going to discuss about tuberculin test, or which is commonly known as Mantoux test. Although this test is now no longer used in case of tuberculin detection test, okay, but today we are going to discuss about this. So tuberculin test or Mantoux test is, as I have mentioned, it is used to detect whether or not a particular person is infected with Mycobacterium tuberculosis or not. Okay, so before going to talk about our Mantoux test, we need to talk about hypersensitivity test reaction. Okay, although it is not a test. So hypersensitivity reaction is a X aggregated immune response. Okay, and that usually cause tissue damage. Okay, and it usually manifests in the individual during second or subsequent contact with antigen. That means whenever a particular antigen infects your body, if it is the first time, there is no chance of any development of hypersensitivity reaction. But if it is its second exposure or third exposure, so as we all know that we have antibodies that have memories, so there can be a over response to those antigens, right? So as a result there can be tissue damage, right? For example, type 1 the hypersensitivity reaction is due to the presence of IgE. Type 2 hypersensitivity reaction is due to presence of IgG and IgM, and type 3 hypersensitivity reaction is due to the IgG. Okay, and type 4 is not due to antibody, but rather it is a antigen specific T cell mediated hypersensitivity reaction that we are going to talk about today in a very brief manner. So that is the idea, hypersensitivity. So for now you can just remember about that is it is a immune reaction, immunological response, okay, that is manifested in individual during the second or subsequent contact of an antigen. So today we are going to discuss about type 4. Okay, we need type 4 hypersensitivity reaction so we can easily understand what is tuberculin test or Mantoux test. Okay, so type 4 delayed type hypersensitivity test triggers antigen specific T cell. Okay, antigen specific T cell play a pivotal role in type 4 hypersensitivity reaction, mainly Th1 cell and Tc cell. We all know that Th1 is the subtype of Th cell. So this Th1 will activate. When the Th1 become activated, it will secrete cytokine, and this cytokine will leads to the accumulation and activation of macrophage, and this macrophage will cause local damage. Okay, this Th1's case is the most predominant here. Tc is occur in some cases only. Okay, so type 4 or delayed type of hypersensitivity reaction, remember, or not occur immediately. There are two type of hypersensitivity reaction, HR hypersensitivity reaction. One is immediate type, another one is delayed type. Immediate type is type 1, 2, 3, but delayed type is type 4. It takes near about 2 days to show its action after the after the entry of antigen. Okay, so it is due to antigen specific T cell, and that is the reason why it takes some time, because we all know that T cell do not have any kind of memory, but B cell has. That is why in the remaining 3 hypersensitivity reaction, those are immediate hypersensitivity reaction, because those are antibody mediated, right? And we all know that antibody have memory, right? So Th1 and Tc cell, Th1 is the predominant here, and it will release cytokine. After being activated, then a cytokine will activate and accumulate macrophage and leads to the local damage. Okay, so that is the type 4 delayed type hypersensitivity reaction. Now let's come to the topic, that is tuberculin or Mantoux test. although the term is Mantoux test, okay, the X is here is not pronounced. So what is tuberculin test? So tuberculin test is the test that is previously used as a standard method to find out whether a particular person is infected with Mycobacterium tuberculosis or not. Although nowadays we have molecular techniques such as PCR, such as many other techniques that we can use, but tuberculin was the very crucial important technique to find out whether a particular person is infected with Mycobacterium tuberculosis or not. So as I have told you that it is a delayed type hypersensitivity reaction, so it is a mainly skin test, so it will be performed intradermally. So it will assay the cell mediated immunity to tubercle bacillus, okay. So as you can say cell mediated immunity, that means it will be antigen specific T cell mediated immunity, right? So here what we will do, here our material will be a purified protein derivative that is known as PPD, although it will be a tuberculin purified protein derivative, and the amount of dose will be 0.1 ml of PPD is injected intradermally, okay. So what will happen? So when we will inject 0.1 ml of PPD intradermally, if the person was previously exposed or has been exposed to Mycobacterium tuberculosis, then the skin will react with the antigen, and as a result there will be formation of red bulb, okay. Although in both positive and negative case there will be formation of red bulb, but in case of positive test the induration will be greater than 10 millimeter, okay, or equal to 10 millimeter. But if the induration is less than 10 millimeter or also or more than that or more less than that, that means in case of negative test our induration will be less than 10 millimeter, okay. So if it is, then we can say that our person do not possess any kind of tuberculosis infection, okay. So delayed type hypersensitivity skin test, it will assay the cell mediated immune response to tubercle bacilli. Here our goal is to inject 0.1 ml of tuberculin purified protein derivative intradermally. So interpretation here, so positive test is to interpret previous exposure and carriage of TB. So before interpretation, let's talk about readings. So positive test indicates exposure to organism. So as I have told you that delayed type hypersensitivity takes near about 2 days to show its action. So our induration will develop after 48 to 72 hours of injection. And negative test, it will does not indicate a active disease, okay. So induration less than 10 millimeter. So all about is the diameter, okay. If the diameter is greater than 10 millimeter, then yes, the person have tuberculin infection, and if it is not, then the person not have any kind of active tuberculin infection, okay. So a positive test interpret previous exposure and carriage of TB. A negative test, tuberculin test, exclude infection in suspected person. Tuberculin positive person may develop reactivation type of TB, and tuberculin negative person may at risk of developing new infection, okay. So that is the idea of tuberculin test, or commonly known as Mantoux test. So again, it is a delayed type hypersensitivity skin test, okay, that will simply assay the cell mediated immune response to tuberculin bacilli, Here the material will be PPD, that is purified protein derivative of tuberculin, which we will inject at amount of 0.1 milliliter intradermally, and as a result, if there is a presence of antigen, then there will be formation of red bulb, and if the induration of red bulb is greater than or equal to 10 millimeter, then we should say that the test is positive. That means that particular individuals has active organisms or has exposure to organisms, okay, and it will take 48 to 72 hours after injection. And in case of negative test, we can say that person do not have any kind of active disease in duration less than 10 millimeter. So a positive test interpret previous exposure and carriage of TB, interpret suspected person is not possessing any kind of infection if the tuberculin test is negative, and tuberculin positive person may develop reactivation type of TB, but tuberculin negative person may develop new infection. Okay, so that is the concept regarding your tuberculin test or Mantoux test. That was someday a basic technique or standard method of saying whether a particular individual is infected with tuberculosis or not. Okay, so I hope this video will be helpful to you, and if it is, please hit the like button, share with your friends, and subscribe to my channel to get more videos like that. So thank you for today.